Answer questions 60 to 65 on the basis of the following information. You are called to the home of a 78-year-old male who is having difficulty breathing. The patient is sitting upright in a tripod position, and you note profound accessory muscle use. His skin is pale, cool, and clammy. Vital signs are blood pressure 180/72, heart rate 90, and respiratory rate 40. Breathing is shallow and labored with a coarse rattling sound during expiration. Auscultation reveals coarse rowels to the nipple line with no air movement in the basis. The patient can speak only in one or two-word sentences. Family members inform you that the patient was sleeping when this episode began and that this has happened several times since his AMI 1 year ago. He has mild pedal edema and neck veins are non-distended. His family first noticed the patient having dyspnea about 25 to 30 minutes ago.
61. Which of the following medication should be used for this patient? A. Albuterol. B. Nitrous oxide. C. Dobutin. D. Morphine sulfate. Answer: D. Morphine sulfate. Rationale: oxygen, morphine, nitroglycerin, and furosemide are all used in the treatment of CHF patients.
62. A patient with the symptoms and history described may exhibit which of the following symptoms prior to an acute onset? A. Orthostatic hypotension. B. Paroxysmal nocturnal dyspnea. C. Cough and fever. D. Headache. Answer: B. Paroxysmal nocturnal dyspnea, PND, dyspnea upon exertion, and increased dyspnea are all signs of worsening CHF. 63. Priorities for the management of this patient include all of the following except A. Decreasing venous return to the heart. B. Increasing venous return to the heart. C. Decreasing myocardial oxygen demand. D. Improving oxygenation and ventilation. Answer: B. Priorities for managing this patient are indicated by choices B, C, and D. 64. This patient would most likely benefit from which of the following? A. Moving him to a supine position. B. Assisting him in walking to the ambulance. C. Having him breathe deeply into a paper bag. D. Giving him intermittent positive pressure ventilation. Answer: D. Increased ventilatory pressures assist in driving off some of the pulmonary edema. 65. If this patient were experiencing right-side heart failure, you would expect to find all of the following symptoms except A. Tachycardia. B. Profound peripheral edema. C. Jugular venous distension. D. Syncope. Answer: D. Choices A, B, and C are all typically associated with CHF. Syncope is not. 66. When performing water-related rescues, use of personal flotation device is required when A. The water is greater than 3 feet deep. B. Rough water is present. C. The rescuer weighs less than 150 pounds. D. The rescuer enters any and all water. Answer: D. No matter the competency level of the rescuer, personal safety is absolute. 67. An isotonic solution is one that A. Has an electrolyte composition like that of blood plasma. B. Is used only in patients who are severely dehydrated. C. Has a higher solute composition than the body's cells. D. Has a lower solute composition than the body's cells. Answer: A. Isotonic solutions such as Ringer's lactate or normal saline have electrolyte compositions similar to that of blood plasma, although they lack the large protein molecules found within blood. 68. What is the most common cause of cardiogenic shock? A. Cervical spinal cord injury. B. Severe allergic reaction. C. Left ventricular failure. D. Internal or external hemorrhage. Answer: C. Cardiogenic shock results most often from left ventricular failure following acute MI. 69. The use of PSG/MAST is indicated for which of the following conditions? A. To control uterine bleeding in a pregnant patient with abruptio placentae. B. To prevent shock in a patient with uncontrollable bleeding in the neck. C. To support the respiratory efforts of a patient with severe dyspnea. D. To stabilize lower extremity fractures in a hypotensive patient. Answer: D. Third trimester pregnancy, impaled objects, and dyspnea are all contraindications for use of the PSG/MAST. In addition, The PSG/mast is contraindicated with any uncontrolled bleeding occurring above the site of the garment. 7E. A patient has been violently beaten. Which of the following statements is true surrounding the care provided by EMS? A. Evidence preservation is the first priority. B. Latex gloves will prevent you from smudging fingerprints. C. Statements made by the patient should be recorded in the report. D. Bloody clothing should be placed in plastic bags. Answer. C. Managing the patient's injury is the first priority of the EMS provider. Any statements made by the patient should be recorded as possible evidence of the crime. 71. An injury to the ligaments surrounding a joint that is marked by pain, swelling, and bruising is called A. A sprain, B. A strain, C. A dislocation, D. Arthritis. Answer. A sprain is a partial tearing of a ligament caused by a sudden twisting or stretching of a joint beyond its normal range of motion. It results in swelling and discoloration caused by bleeding into the tissue. A strain is an injury to the muscle or tendon and usually does not result in discoloration. A dislocation occurs when the normal articulation of two bones is disrupted. Arthritis is inflammation of joints characterized by pain and swelling, but does not result in discoloration. 72. When administering 4 fluids to a trauma patient, it is critical to continuously monitor which vital sign? A. Breath sounds, B. Capillary refill, C. Blood pressure, D. Pupillary response. Answer. A. Breath sounds are particularly important to monitor during 4 fluid administration because of the danger of fluid overload, which will initially manifest as pulmonary edema. 73. Why is morphine sulfate used in the management of AMI patients? A. To help distinguish between angina pectoris and AMI. B. To relieve pain and reduce myocardial oxygen demand. C. To decrease the likelihood of ventricular dysrhythmias. D. As an alternative therapy for patients allergic to lidocaine. Answer. B. Morphine relieves pain, decreases venous return, and reduces the oxygen demand of the myocardium. 74. Paroxysmal nocturnal dyspnea, PND, is commonly a sign of which of the following conditions? A. Myocardial infarction, B. Ruptured aortic aneurysm, C. Left side heart failure, D. Right side heart failure. Answer. C. Left side heart failure with pulmonary edema is often associated with PND. PND manifests as difficulty breathing when the patient lies flat. As the condition worsens, many patients will report the need to sleep sitting up in a recliner. 75. Management of left side heart failure includes high-flow oxygen, 4 of crystalloid solution, ECG monitoring, and the administration of which pharmacological agents? A. Beta blockers and furosemide. B. Morphine sulfate and nitroglycerin. C. Nifedipine and sodium nitroprusside. D. Labetalol and norepinephrine. Answer. B. The accepted protocol for management of left-side heart failure is given. 76. You are inserting the tracheal tube when you begin to hear the sound of the patient's breathing. Your next action would be to A. Inflate the distal cuff and secure the tube. B. Wait for the patient to inhale and insert the tube farther. C. Pull back on the tube and secure with tape. D. Attach an end-tidal CO2 detector to confirm placement. Answer. B. As the tip of the nasotracheal tube reaches the glottic opening, you should hear the respiratory effort of the patient. Insertion of the tube past the vocal cords is timed to the inhalation phase in order to minimize resistance against the tube itself. 77. What is the initial electrical treatment for a patient with third-degree AV block who is symptomatic? A. Insertion of a demand pacemaker. B. Unsynchronized cardioversion. C. Transcutaneous cardiac pacing. D. Synchronized cardioversion. Answer. C. The preferred field treatment is transcutaneous pacing. Definitive treatment is pacemaker insertion. Drug therapy indicated for this patient is aimed at increasing cardiac output by improving contractility, force of contractions, or increasing rate. 58. A patient suspected of having an abdominal aortic aneurysm will receive oxygen. And 4. ECG monitoring and rapid transport as part of his or her treatment. What else should you do when treating such a patient? A. Apply the PSG/mask garment. B. Carefully palpate the abdomen. C. Administer dopamine or dobutamine. D. Administer S-L-nifedipine. Answer. A. Treat the patient for shock and transport rapidly. Do not palpate the abdomen. This is one of the few medical conditions that may still benefit from the use of PSG/MAST, as the garment may tamponade any bleeding that may be occurring. Medications which stimulate the cardiovascular system should be avoided. 79. A 52-year-old male has been ejected from a car. He is apneic with a slow pulse palpated at the femoral artery. Which of the following procedures would best manage this patient's airway? A. Nasotracheally intubate the patient. B. Ventilate with the bag valve mask and attach to high-flow oxygen. C. Apply a non-rebreather mask with high-flow oxygen. D. Perform immediate orotracheal intubation. Answer. B. This patient needs immediate oxygenation and ventilation. Using a bag valve mask will accomplish this task most effectively. 80. Vagal maneuvers are used to treat which type of dysrhythmias? A. Premature atrial contractions. B. Ventricular tachycardia. C. Atrial fibrillation or flutter. D. Paroxysmal supraventricular tachycardia. Answer. D. PSVTs, paroxysmal supraventricular tachycardia, may be managed by vagal maneuvers, such as the Valsalva maneuver or ice water immersion.